I'd like to talk for a few minutes about the genetics report and how we learn about these diseases. So when we get the gene panel report, even when we order it, we should always ask to get variants of undetermined significance. We don't know if these variants are causative for the disease or not, but we can work with these variants to determine how likely they are to cause disease in our patients. We need to correlate clinical findings with genetic findings. So if I send a patient who I think has Bartter syndrome and I get a report of 2 variants in Bartter's, I think that's fairly likely that the patient will have Bartter syndrome disease. Whereas if I get a report of another gene for nephrotic syndrome, that's a variant of undetermined significance, for me that might be less likely. So we always want to correlate these things and try to learn from these genetic reports. And it's really great. The genetic panel providers often have genetic counseling, and these counselors are really great for the doctor to talk to and discuss the mutation and try to figure out what to do next. Another thing that one can do is to consult experts in the field about genetic findings. So if there's a renin mutation that you've heard of, or UMOD or MUC1, please contact us. And we're so happy to talk to you about these things and try to even put these mutations in cell models to help determine if they're likely pathogenic or not. We may already have some mutations that we think are pathogenic, and so we can accelerate this process working with clinicians. Something I find that's really, really helpful is to cut and paste the genetics report right into the patient's office note. Genetics is changing all the time. We're learning about new genes, and I like to have that at the bottom of my note, so every time when I see the patient, I have that there, and it helps me to think a little bit more to make sure I've made the right diagnosis or I'm thinking about their diagnosis. Now, how do I learn about the disease? I face the same problem as many of you do. I get these gene mutations back, and I'm like, oh my gosh, I don't know anything about this condition, right? So it's determined by where we are in the process of the disease. So there may be only several case reports. So then I really need to read these case reports in the literature. And so what I'll do is I'll just type the gene name in, say REN, R-E-N, and then in PubMed I type in human mutation after that. And that'll help me to find these mutations and reports on them. As we go further down the pyramid, we have more information available. UpToDate is a great place to get information. Now, usually it's not gene-specific, but more grouped into conditions. However, it's a really great starting point. Gene reviews are written for geneticists and genetics counselors and doctors, and they're also really, really good. They provide a lot of information. And then there are reviews and guidelines. So I like to enter the gene into PubMed, and you can also enter the mutation, the specific mutation, or when you're looking at these articles, put that mutation in, because that will help you to determine if that mutation may be associated with better or worse prognosis. I like to go to UpToDate. The other thing you can do is to go to PubMed and type in gene reviews and type in the name of the mutation. And I like gene reviews because it provides information about specific mutations, clinical findings, and what you need to do to follow the patient. So just as an example, in our disease, if this was early on and you had a patient with the renin mutation, you would find this article by Dr. Zivna, which would explain it. If it was a little bit later on, you could also find this article by Dr. Schaefer, which shows there are milder forms of the disease. And then if it was still later, you could find this article that we did, the case series, which helps us to better understand what's going on in totality.